So Jim, tell me, how does modern lifestyle contribute to dry, sore and irritated eyes?
Modern lifestyle today, Kate, is a major contributor to dry eyes. We have air conditioning and computers, which basically all of us are in. Those two factors are the main things. But we can add to that dietary issues. There's a lack of omega-3 in the diet. And of course the ageing population is a big issue as well. We all certainly are ageing. Therefore we've got a situation with an urbanised society now that virtually everyone is complaining of dry eyes. The main lifestyle factors, as we've discussed in the previous question, is in fact computers and the air conditioning, but we've got to also remember we're all on aeroplanes these days. The worst environment of all is in fact the dehumidified air on an aeroplane. So you combine all that together and again you've got an environment where we can't escape. The prevalence of dry eye in Australia today is ubiquitous. I can't tell you the amount of people that sit in this consultant chair every single day that complain about this problem. You know, if I specifically go fishing for the question, you'll get virtually 100% response rate. Actimist is a unique eye lubricant that effectively and efficiently treats dry eyes by delivering both an aqueous and lipid phase into the eye using a micro droplet technology. Actimist is different to eye drops as it is sprayed on the closed eyelid. Actimist is a liposomal mist. Liposomes are microparticles of moisture. When you spray the Actimist on a closed eye, the liposomes reach the eyelashes and then mix with the body's natural lipids to refresh and repair the lipid layer of the tear film. Every time we blink, we stimulate the release of these lipids so that they lubricate the eye and keep the moisture in the eyes. Comparing eye sprays to eye drops is simple. On average, eye sprays are your best first choice. We need to remember that no one product or delivery system is going to be best for every patient, but eye sprays certainly tick all the boxes in most cases. Efficiency is superior with eye sprays because they can be instilled by any patient without needing a mirror or needing to tilt their head back. Eye sprays are possibly safer than most eye drops because they stay sterile for 6 months. Tolerability of the eye sprays can be compared to single-use unpreserved ampules, and they are certainly superior to most of the preserved bottled eye drops, which need preservatives to keep them sterile. And finally, patient preference favours eye sprays as they are more convenient and easy to use. This in turn favours compliance, which is such an important issue today. The key benefits of using eye sprays are the installation process. Most patients have significant issues with trying to put drops in their eyes. The eye spray, of course, you can do with your eyes closed, and then firstly it's very simple, and secondly it just permeates into the eye very efficiently over the course of 4 hours. Questions that pharmacy staff can ask, I'm not sure they even really need to ask too much. Most of the patients that come in that have dry eye that are of any significance will basically come in and tell you they have dry eyes. But symptoms that you can ask about is grittiness, itchiness, burning, even wateriness is an ironic symptom that patients come up with. Once the eye gets dry, all of a sudden they end up flooding as well. So they're basically the questions that I'd be asking. Decongestants in particular are very poor choices for treating any eye condition, in my opinion. The red eye is really just a symptom of a problem. The best way to treat this is to actually get to the root of the problem, not sort of mask it with a red eye treatment. These decongestants, not only do they constrict capillaries and slow the blood flow to the eye, they also provide a whole dose of preservatives. And once you get onto this vicious cycle, in the end, it's actually a major cause of dry eye. So my recommendation is look at an eye. If it's red for a reason, and don't mask it. It's probably best to treat it as dry eye in the first instant because that's by far the most common cause of red eyes.